Good morning. Welcome back to Bipolar Me, episode 4. I have one of my favorite office toys with me, my squishy brain. Oops. So today is what I like to talk about, where we left off with my first hospitalization, and there was a decision made to do ECT, the nuclear bomb. So electroconvulsive therapy, it's a mechanism in which, a trained physician and a group of nurses and an anesthesiologist sedate a patient and induce a seizure. That's an electrical current. It goes to the brain. It's used to treat patients who are severely depressed. It can be used to break a mania, catatonia, agitation, depression, and dementia. It's also useful in pregnancy. Yes, it is safe enough for pregnancy. And when many of the medications that women, can't be used. So, because lithium and Depakote are known to cause birth defects. So we have to find something that's safe enough to treat those women because, they still deserve care as well. And what if, say, my bipolar disorder had been found before I got pregnant and my husband and I had made an educated decision that, we wanted to have children? I would have needed a safe, viable option to get through the pregnancy. So, since I wasn't responding to medications the way my physicians had hoped, they decided to try a course of ECT. I'd been hospitalized, almost close to a month at this point. So they went over all the paperwork. My husband, my doctor, the social worker, and myself, we all met and went over everything in great detail, and made the decision to move forward with treatment. ECT is not, of course, it's recommended lightly. It's usually used as the last case scenario, and nor should the decision to undergo it be made lightly. It requires a lot of thought and conversation. You really have to go through the risks and the benefits and decide if it's right for you. So it was carefully explained. The knowledge that I would undergo anesthesia made it a little bit more bearable. It was explained that the biggest side effect to date was memory loss, that it was typically transient and limited to the course of treatment. My course was going to be initially 3 times a week for a month, then twice a week for a month, then weekly for a month, and then every other week for 2 or 3 months. So I would get woken up in the morning early, get a shot of an anticholinergic, something that was meant to dry up any secretions to make it easier for anesthesia to manage my airway, and reduce the risk of aspiration. I would generally stay in my room until they came for me. The ECT was done in my unit, and isn't this brain so fun to play with? So I was fairly used to seeing the patients, wheeled by us during the breakfast hour to the recovery room, so that was, no big deal at that point. And in the room, an anesthesiologist would put an IV in my arm, give me a steroid, an antiemetic, something to stop vomiting, and an anti-inflammatory drug, some typically very strong NSAID class. We think of like ibuprofen or something like that, but something stronger than ibuprofen, to decrease any side effects I may have afterwards. A blood pressure cuff would get put on my arm and electrodes to each side of my head. An oxygen mask would go on my face. I would get told I would be sleepy, and those were pretty much famous last words because they were always the last thing I would remember. And the next thing I know, I'm in the recovery room being offered water and being told that breakfast was waiting for me when I was ready. The only physical evidence to my treatments were just this horrible bruising I would get from where the blood pressure cuff was. Just these large streaks of purple circumferential, running down my arm. But once released, I would go back to my room and just pretty much nap the morning away. Or later, once I was outpatient, I'd sleep the drive home, and then for another few hours once we got home, I used to call it my ECT hangover because it never failed to happen. But slowly and surely, my mood brightened with the ECT. And it worked. I did experience memory loss and for a short while some cognitive fuzziness, I like to call it. The fuzzy feeling improved as the ECT tapered down, but the memory loss persisted. We were told that it would be limited to short term, around that time of the treatment, but I found that long-term memories have been erased as well. If you recall in an earlier episode, my life in Maryland, I really never recovered. There's bits and pieces, but we'll still travel back and I'll be like, oh look, they put a Target up there, and my husband will be like, oh my God, you shopped at that Target every single day. And I'm like, no, really? There's things like that. I just don't. Or they'll talk about a funny story and I'm like, oh, that sounds nice. I guess I'm gonna have to trust you that it happened. Like one day I said to my husband, oh, I love Seal. We should see Seal in concert. And he's like, oh my God, we did. Don't you remember? Nope. Gone. So there's some sad things that will come out of it, but it got me better, and that's the key thing that we need to keep our eye on the prize about. So, I've missed out on years of memories with my husband, and he got pretty frustrated, every time he'd recount a story in true Torian fashion. I would tell him that it was fiction, that it never occurred, that he was lying, and, for example, the Seal thing. And I think once I even told him he's making all this stuff up. Like the Seal stuff, to avoid having to buy concert tickets, which is ridiculous. But even more telling was every time we left to have a treatment, we would drive by this home on our way there. And every single time I would remark, oh my gosh, what a beautiful home. And asking Keith if we had ever passed it before. And every time you have to be like, yes, we pass it every day. And I would just never remember it, ever. At first he thought it was kind of cute, but then it got really old. And he started to then realize genuinely how much I didn't know anymore. The memory loss associated with ECT is real, and it can be quite devastating. As frustrating as it was for my husband to get called a liar, it's doubly frustrating to not remember huge chunks of my life, really. And a life that I had lived to the fullest and was pretty happy doing. And that effect shouldn't be minimized. People need to know about this. But it isn't to say that ECT did not and does not have some benefit. I fully believe at that time, when I underwent my first course, it saved my life. And you know what? Ditto for my second course of ECT. It saved my life. The memory loss isn't as significant with the second course, but that's because as soon as I recognized that there were some serious cognitive changes happening, I stopped the ECT. I said, no more. No more. We're not doing this. I have too much going on. I'm about to enter a doctoral program. I need my brain, and my patients need my brain. I've worked too hard and learned to make too many accommodations that I cannot start from scratch again. So after about 2 weeks of my course at ECT, I was able to be released to home. It was clear I was improving, but at the same time, no one wanted to talk about it or even was willing to talk about it. It took my husband calling my social worker and forcefully informed them that he was taking me home for them to call him back and discuss that You know what? Your wife is actually appropriate for discharge tomorrow, and we'll be happy to arrange it for you, sir. But that didn't mean life went back to normal immediately. I still had to go through ECT, and I couldn't even consider going back to work until my ECT was tapered to at least weekly to make it reasonable to work. I also had to make arrangements to go back to my therapist. I pushed him for answers as to what happened to that original psychiatrist who never returned the phone calls. You know, it was clear at that point that the original antidepressant prescribed did make me worse, and the lack of care directly impacted my going into the hospital. It was a preventable hospitalization if someone had just answered the phone. And again, he said the only answer he ever got from that doctor was he didn't know he was supposed to respond to all those calls and emails. If you're a provider out there like me, you know the answer is pure bull crap. No one ever ignores all those calls saying your patient is suicidal on a medication. You pick up the phone and you call. You find out what's going on. No one leaves a patient hanging like that. I firmly believe that. However, I have a saying. Bad medicine happens to good people. It does. There are days I'm not perfect. But I do my best. And when I'm wrong, I own up to it. To my patient's face. Because that's how I earn their trust and keep them coming back. The problem is, I feel like if I behaved like that as an advanced practice nurse, I would have found myself in court explaining my behavior. However, this person had no repercussion. The bottom line, though, going back to the ECT, is I enjoyed my outpatient ECT. I looked forward to the naps. I gradually felt better, and I eventually learned to compensate for what I could not remember. I just had no idea that the treatment that saved me was also going to be the one that would nearly destroy me. Stay tuned for episode 5. We'll get to that. I hope you enjoyed my little buddy, the brain, because that's what this is all about, our brain. Our brain is, to me, the organ that this is all about. We discriminate against it, yet without this brain, our heart wouldn't beat, our GI system wouldn't function, our lungs wouldn't inflate, we wouldn't be able to see, I wouldn't be able to talk to you right now. But somehow, when something's wrong with our brain, we argue with our psychiatrists about going to the ER. But we don't argue with our cardiologists about going to the ER when something's wrong with our heart. We need to change that mindset. And as a provider, if something's wrong with our brain, we need to not be scared to speak up and say we need help, because we can keep our careers intact and stay functional if we just speak up and say, help me. The world doesn't need to know we're in treatment. You don't have to be out there like I am. But you can get help. And I'm here to show you how. Thank you for watching. If you like what you see, please like this video, please share it, and most of all, subscribe to Bipolar and Me. Thanks for watching, and I will see you next time.